Good morning to everybody. LN Ayurvedic PG Entrance Coaching Center, Salimnagar, Malakpet. Today's concept is how to assess the lakshanas of vata when mingled with ama. See, generally from the beginning I am telling this entire universe is made with five elements like Prithvi, Ap, Tejo, Vayu, Akasha. So, how the body is constructed in the same manner, the humors or whatever say the doshas and the dhatus and the malas maintaining the body. So, the disturbance in the doshas, dhatus and malas is the disease. The non-disturbance, that means when they are maintained in a way, in normalcy or in a normal manner, no disease. Here generally what I have told you, vata, pitta, kapha playing major role. In olden days, what are the investigations? Today, what are the investigations? How we are following? Just by observing a body, deham or sariram, whatever you say, without investigations, how we are assessing the doshas. In today's class, I will tell you how to assess the doshas in the system when vata dosha interacted or having the influence of ama. What is ama? Because of improper digestion, the end product which is released because of improper digestion. See, different factors are there behind the digestion. Behind the digestion, different factors are there. So these factors will improve the or influence the digestive system. When it is improper, ama is formed. Ama means a toxic material. Some people will say, now I cannot take the food. After 3 hours I will take. After 1 hour I will take. If I am calling all the 10 members at a stretch to feed them, all the people will not have the same degree of taste. That depends upon the power of digestion, Jhata Agni, and other influencing factors like Vata, Pitta and Kapha. My concept is in the system of Ayurveda, how it was assessed. Let us see now. Suppose this ama mixed with vata or one vata mixed with ama, it is called as samavata. So what are the subjective symptoms? What type of lab investigations we require in the system of Ayurveda? Today we will come to know. What I am repeating once again. What type of lab investigations we require in the system of Ayurveda? Whether we require or not, in what way or what for, up to which extent we have to depend on the lab investigations. So what will, see, a person is suffering from stomachache or indigestion, gas trouble, constipation, abdomen scanning taken place. Otherwise, in deeper level, they will go for the liver function test. How we are going to assess all these things, we will come to know. It is a modern concept, wonderful concept in modern science. I too will accept it. But in our science, in the system of Ayurveda, in a natural way, how we are going to assess, we will come to know. Right. See, when Vata is mixed with ama, we are calling as what I mean to say, Vata dosha is mingled with ama, so it is called as samavata. What are the subjective symptoms? Vibhanda, constipation will be there. It's a factor known to you, constipation. And agrisada, digestive power will be becoming weak day by day. The digestive power, here age is not a criteria. Generally, the age is not a criteria. What happens in the digestive system, I am telling. The digestive power decreases. Then tandra, drowsiness will be there. And here you have to observe one point. In classical science, in olden days, centuries back, in medical history, today's technical terms like constipation, drowsiness, and non-specific pains in the abdomen, swelling in the abdomen, and then heaviness of the abdomen, pricking pains in the abdomen, how they have mentioned that you should know. It is very, very important in this topic. The concept is, my motto is to express how in our classical science they have expressed it. Even today they are standing. No change, no second thought about this concept. Let us see. Drowsiness of the body will be there, heaviness will be there, and a gurgling sounds coming from the abdomen. Swelling will be there in the abdomen. Pricking pains will be there. That is called a nistoda. The pricking pain is called nistoda. People will say, sorry, a sort of pricking pain in the right side near the liver. They know the liver, the organ, sides no. See, like doctors today, people are saying, where is there through the Google Tali, Google Mother, they are finding the locations of the body organs and say, sir, near the appendix there pain is there, near the umbilicus pain is there, around the umbilicus pain is there. See, and near the pancreas pain is there. Like that they are saying. So, what is the role of doctors in the system of Ayurveda? How we are going to diagnose the subject of symptoms under which category? How we are going to analyze which dosha is mingled here, which dosha is playing a role here? That point we are going to find out now here. See, now swelling will be there, nishtoda, pricking pains will be there, and heaviness of the abdomen also, heaviness of the abdomen also will be there, and snigdhatva, say a oily nature of the body parts will be there. You see, some people's skin you touch, it will be very, very rough. Some people's skin you touch, you can see also, you can see by seeing darsana pariksha, you can understand, no lab is required, and oily nature will be there. By observing the what type of lab you require today. So far, to observe these subjective symptoms, these are from the patient side only. Patient is expressing. Non-specific pain is expressing, Vedana. Swelling you can observe. Pricking pains is expressing. From the body is expressing. Through the mind is expressing. And Snigdhatva, oily nature of the body parts will be there. And then Arochaka, tastelessness. Taste will not be there to have the food. Just now, when 10 persons are there, they will not have the taste to degree changes. Tastelessness, then lethargy nature will be there. Dullness, lethargy nature will be there. ఎప్పుడు చూడండి చాలా డల్గా ఉంటారు, హెవీగా ఫీల్ అవుతుంటారు, పని చేయడానికి కూడా మహాబద్ధకంగా ఉంటారు. అలాంటి వారు అనమాట వీరందరూ కూడా. అంటే వారిలో ఉన్న ప్రాబ్లం ఏమిటి అంటే ఆమము లేదా ఆమము లేదా ఆమ, టాక్సిక్ మెటీరియల్ ఇన్ ది అబ్డామిన్. So, if you are able to satirize the toxic material, eliminate the toxic material, the problem is solved. See, try to understand how many subjects are going to come down just by giving the treatment here, digestive system treatment. Then, Saitya, feeling of cold nature will be there in the body. And one more thing, these subjective symptoms just now what are expressed in the body, if you are watching, they will aggravate because of the cold climate, cold items, cold climate, vihara, cold climate that is, and cold ahara, and even by cold items also, the subjective symptoms will aggravate. And but what happens, they will have a taste to have hot items, spicy food. They will have a taste towards the spicy food, pungent food. So, now I have told you the reasons on what ground the subjective symptoms are arising. Now we are assessing vata, now we are assessing where vata mixed with ama. Toxic material in the body. Food poisoning, you take heavy mess, digestion will not be there, improper digestion, heaviness of the abdomen will be there, lethargy feeling will be there, dullness will be there. Is it not? Oily nature of the body parts will be there. Just by darsana pariksha, you can find out all these things. And when they are going to aggravate in the morning hours. See, you ask the patient. So that is why interrogation, prasna pariksha is very, very important. Darsana prasna parishanaiki parikshetaja roginam. See what he says, sir, these subjective symptoms are increasing in the morning hours, cold climate, cloudy climate, and evening hours. It indicates the dominancy of the vata. Now see, I have told the subjective symptoms. How the patient will be liking. Reversed feelings will be there. I will tell you one thing. See, what is treatment? Prithvi Mahabhuta Jala Agni Vayu. Is it not? From outside, cold climate and influence of the Prithvi in the body, in the sense, intake of the salt, more carbohydrates, whatever you say, This is happening, this was happened. So it is mainly because of Prithvi Mahabhuta and Jala Mahabhuta. What you have to do? Now you are introducing Agni Mahabhuta and Vayu Mahabhuta. That is the line of treatment in the system of Ayurveda. So fasting, Lankhanam, what is it? Fasting you have to do. Langhanam, what you are to do. So you are creating the Akasha Mahabhuta in the abdomen. When you are able to create the Akasha Mahabhuta fasting, no sir, today I cannot take sir. See, that is the thing from your mind what you are expressing, is it not? In such conditions, or it is nothing but the introducing or introduction of the Agni Mahabhuta and Vayu Mahabhuta and Akasha Mahabhuta. Now you got clear? The disease because of the Prithvi Mahabhuta and Jala Mahabhuta, and you are introducing the Agni Mahabhuta, Vayu Mahabhuta, and Akash Mahabhuta. The problem is solved here. Fasting, Langhana Chikitsa, Langana Chikitsa, Vurdhi Samanaya Sharvetam Viparita Hi Vipareha. See, in our previous episodes, I have explained why the disease is coming. That means what is treatment, what require you keep, what not there you keep, what additionally there in the cell. What additionally there in cell you are eliminating. You are eliminating through the proper different srotas will be there in the system, is it not? Like Mutrava srotas, like Annavaka srotas. So different points are there. So through this, the treatment is when followed in the sense the ama comes down. When ama comes down, this vayu becomes plain. In the sense, nirama, it is called as nirama. Then only the subjective symptoms will come down. Just now what I have told you. Is it clear to you now? This is a simple way how we are assessing the vata dosha or samavata based on the Lakshana Samuchaya. Based on the Lakshana Samuchaya. Now you understood how to assess the samavata in the body. So then I told you, patient psychology also you are understanding here. Psychological treatment. So he likes hot items only. He wants to be in hot climate. See that disease is because of the cold climate. That disease is because of the improper digestion. That disease is because of the sluggish liver. Now, in modern science also, the concept is same. They are going to think about the strategy of the liver. So, if it is neglected in long run, the swelling, what I have told you, left neglected, it leads to liver disease, Udaravikara, or Jalodara, or kidney disease, or Vrkavikara. In certain conditions, even the heart also may be involved. Edema, this edema goes down and limbs will be swollen. That means lower limbs will be swollen. So what you understand here? Involvement of the kidney, involvement of the heart, and involvement of the liver. See how involved, just because of samavata, all the things are going to happen. So let us remove the ama from vata or eliminate ama, then vata becomes nirama and then person will be healthy. So in this class, you are understanding how to assess the samavata. In case of any doubts, just see why this presentation is taken today. In olden days or in the system of Ayurveda, how the abdominal subjective symptoms have been explained through the patient or by the patient, through the textbooks, through the classical Sanskrit language, through the system of Ayurveda, how they express it. See, this body is not today's, subject symptoms are not today's. The point in the line of treatment they will be different. That is called root level treatment is mandatory in every case. Following the emergency treatment and follow the Ayurveda treatment also, this will help you in a tremendous manner to get rid of the problems as early as possible. Okay, now Samavata, Lakshanas, how to eliminate them? What are generally speaking? Langhana, number one treatment. That means you have to follow the proper vihara, ahara. Apart from that, good digestive agents you have to take, like jilakara, jeeraga, pippali, pippallu, maricha, miriamulu. So these drugs in a combination or independently also can be taken under the supervision of a doctor. That is very, very important. See, pepper taken, they will say more pepper is given, sir, burning in the eyes, burning in the abdomen, burning in the rectum also they will say sometimes, how they are saying. Because that means you have to know, fix the matra. By knowing the subjective symptoms, you should fix the dose without observing the cost agni, how it is there. Different types of agnis are there. Without knowing those agnis, if you are stressing or fixing the dose, the treatment may be up to that extent or not to get rid of the problems. Thank you. today's class is over. Now today's class is over. In case of any doubts, you can access our number 9014141722, Dr. Simhadri, to have awareness, and to have the awareness programs are to understand what is vata, how the natural food products are helping. Now, in this case, we are telling Jelakarra, Pippallu, what you are calling, Miriyamalu, Maricha, all these things are easily available drugs. Going on taking within 1 week or 10 days, the problem will be solved. So, 3 drugs today I have told you, 3 ahara dravyas. Sunti also you can take. Miriyalu, just now what I have told you. You feel. So understand the importance of the sunti, maricha, pippalu what you are calling, and jilakara, jiraga. Hingu also can be given in these conditions. Hingu also can be given in these conditions. Then how to take, what to take? Consult your nearest doctor. Consult your nearest doctor or any available doctor. Without having proper assessment, if you are taking ahara travayas also, they will give negative effects. Okay, in case of any doubts, yes, you can contact. Thank you. Today's class is over.